Yeah, so I think the main role of a primary care provider is honestly to do a thorough sleep history. And when I say thorough, I know they have a lot of other things that they have to look for, but some of the basic questions is, is the person sleepy during the day? If they're sleepy, we know that sleep apnea treatment works, and it works because it helps improve their daytime function, it helps quality of life, it helps depression scores, and it also helps, potentially helps reduce motor vehicle accidents, although some of the recent trials weren't able to confirm it. But overall, I think if you have a sleepy patient, you really need to understand whether or not they have obstructive sleep apnea or whether they're sleep deprived or whether they have both, because sleep deprivation we know is not good from a lot of animal work and even early human studies for diabetes risk, for hypertension risk, obesity risk. So I think a primary care physician's job is really to find out if a person has any sleepiness symptoms in the daytime, and if there is an indication, refer them to sort of tease apart whether it's a sleep apnea by doing a sleep study, or looking at whether or not they have other sleep disorders. But more commonly, we find that they're just sleep deprived or have short sleep duration because of societal and lifestyle, requirements or pressures. So cardiovascular disease is one domain, but there's neurocognitive impairment, there's daytime functioning, there's mental health, which there's a clear signal when you treat sleep apnea, mental health, depression improved in the clinical trial, the SAVE study that I'm talking about, published in the New England Journal of Medicine. So I don't think we can really lump all of the outcomes together and say, well, sleep apnea doesn't really seem to improve cardiovascular outcomes, at least for the time being. But we know that it improves all these other things. So I think appropriately screening, appropriately referring, and diagnosing sleep disorders is very important because it does have an effect on a lot of health outcomes, including obesity, including your dietary intake, which can drive, obviously, as you know, numerous other outcomes and health endpoints. So yeah, I think we're still in the infancy stages of really trying to understand how sleep apnea affects a lot of these domains, specifically cardiovascular disease.